Ladies and gentlemen, let me go on to our next session, which is a very significant one. It is the announcement of the partnership between NATHEALTH and TiE Mumbai. Now, let me take the privilege of introducing our eminent panelists for this announcement. We have with us once again Dr. Preetha Reddy, President, NATHEALTH and Executive Vice Chairperson, Apollo Hospitals. I'd like to introduce her briefly. A member of the founding family of Apollo Hospitals, Dr. Preetha Reddy is widely recognized for her contributions in making high-quality healthcare accessible to millions and for her support to various entities and industry bodies working for the betterment of India. In recognition of Apollo delivering outstanding medical care during the COVID-19 outbreak, Dr. Preetha Reddy was awarded the Economic Times Businesswoman of the Year award, and she was also conferred with the Healthcare Personality of the Year award by FICCI for her far-sighted vision, exemplary work, and notable contributions to the fields of healthcare and social science. Welcome again, ma'am. Let me now introduce to you, ladies and gentlemen, Dr. Harsh Mahajan, the Senior Vice President, NatHealth, and founder and chief radiologist, Mahajan Imaging. I'd like to say he's a pioneer in the field of medical imaging in India who has established a chain of high-end diagnostic centers in India. He's a practicing radiologist and was awarded Padma Shri by the Government of India in 2002 for his contribution to this field in India. He's the past national president of Indian Radiological and Imaging Association and consultant to the International Atomic Energy Agency, Vienna, chairman of CARING, Center for Advanced Research in Imaging, Neurosciences and Genomics, which is involved in translational research in the field of artificial intelligence and cancer genomics, which is credited with developing a unique platform for testing, validation, and adoption of AI algorithms in clinical practice of radiology around the world. Warm welcome, Dr. Mahajan. Let me now extend a warm welcome to Mr. Amit Mookim, the member of Governing Council of NatHealth and MD of IQVIA. And he's been a management consultant turned into a business leader and currently oversees the India operations of IQVIA, Global Healthcare Technology, Information and Clinical Research Organization. Mr. Mookim's experience in digital health has extended to supporting innovation and entrepreneurship in India. He's an advisor to the NHA on innovation, president at TiE Mumbai, and mentor to health startups. Prior to IQVIA, he was head of healthcare at KPMG, and he was one of the youngest partners in KPMG and helped the firm build and grow the private equity and strategy business and the healthcare practice for India and across Asia Pacific. Warm welcome to you once again, sir. Now I'd like to extend a warm welcome to Mr. Naveen Raju. Ladies and gentlemen, he's the Executive Director, TiE Mumbai, a seasoned leader with more than 18 years in various roles, including startup ecosystem development and integration, helping founders build businesses, door opener, setting up angel networks, fundraising for startups and boutique investors, business development, incubation and acceleration consulting, leadership and key influence management, cross-border and trade location strategy, customer acquisition, new market entry, and initial setup, industry analyst for ICT, deep tech, life science sectors, and new business models for the entrepreneurial ecosystem in India. Welcome, Mr. Raju. Now, ladies and gentlemen, Dr. Preetha Reddy, President NatHealth, Dr. Harsh Mahajan, Senior Vice President NatHealth, and Mr. Amit Mookim, Member Governing Council NatHealth, and are on behalf of NatHealth for the announcement of this partnership. But I'd like to say Mr. Amit Mookim also in a way represents TiE. So I'd like to say that he comes on behalf of both NatHealth and TiE, and we have on behalf of TiE clearly Mr. Naveen Raju, Executive Director, TiE Mumbai. With that, I'm going to hand it over to Dr. Preetha Reddy and Dr. Harsh Mahajan to please take over.
Thank you very much. And, I'm delighted to be on this session with Dr. Mahajan, Amit, and Dr. Naveen Raju. It's again a very significant tie-up. And this MOU with TIE is purpose designed to facilitate partnerships. And we all know that, this year has taught us about how important it is to collaborate. And there is no way the world going forward is ever going to operate in silos. And so partnering with TIE to us at NatHealth is significant and important. Again, it's all about high growth startups and for programs built on innovation. And we know and understand again that innovation is the key to the future. Can we work together to innovate for a future of India which is healthy, which is accessible, which is affordable and accountable? I think we can. And we've shown it that as Indians, we can truly be Atmanirbhar in the way we function. And we can find ways and means to show examples for the rest of the world. So it's a wonderful tie-up and a partnership, and I really want to thank Mr. Naveen Raju for that. We are looking at creating a devoted space for health. And this, I think, with the partnership will make it even more focused and significant. Many things have happened, many partnerships over the period of this 1 year. And to us, this is, again, an important step in the right direction. Thank you for thinking of Nat Health and Amit for bringing it together from both sides. And Dr. Mahajan, I know that the innovation, AI, a lot of things are happening out of your stable. So I think you're the right one now to take over this initiative and take it forward. So thank you all. As always, I'm excited and delighted to be part of this.
Thank you very much, Preetha, and pleasure that you're here, Dr. Raju and Amit. And Amit, thank you very much for making this tie a reality between TiE and NatHealth. And as I learned, TiE really, the Indus entrepreneurs in the and US and these three people who got together in the US and set it up in 1992, and they've mentored over 10,000 startups, and 1,000 of them being in the health space speaks volumes of the amount of work that's been done, and the amount of capital that they've been able to raise is just mind-boggling. I mean, it's in 2000 till 2000, I believe it was $75 billion. So God knows what it must be now. And we really look forward to this partnership because we've seen startups, especially in the healthcare space, where a single person or two or three people get together, they have an idea, they make it reach a certain level, and then that's where it stops. Bringing it into day-to-day clinical practice, bringing it to the market is really the toughest part. And many of these ideas have languished by the side or been picked up by others in other geographies of the world, and they've actually gone and done it. An idea which actually saw fruition, uh, uh, which was seeded in India and then saw fruition somewhere else. So I believe this is a very, very significant tie-up with TiE mentoring these organizations, these small startups, and kind of hand-holding them and bringing them over to NatHealth with its, the healthcare providers, the diagnostic service providers, the medtech, all of them being here, who could then take it to the next step. I also would propose that we should do a one-day innovation summit as a kickstart to this partnership, and it can be done as and when we are able to do it in the coming months, which would really galvanize this partnership and which would also send a word to the startups that there's some collaboration which is willing to hold their hand and take them over this difficult part. So translational research and then bringing it to the market. So thank you all very much. I wish this success. And Dr. Raju, we will surely work very closely with you, with Amit being the link between the two organizations. Thank you very much.
Thank you very much, Mrs. Preetha Reddy, Dr. Mahajan, Amit, Siddhartha. I think this is a wonderful opportunity for a lot of our innovators and disruptors, especially, I mean, they're all trying to innovate in silos, but this partnership, what it does is it actually gives them all a customer connect, or at least an access to you folks to go to the customers eventually. And especially today when the acceleration for healthcare is going to be at its fastest ever in the world, I think this is the right kind of platform where we can get startups to talk to industry, and we look forward to enabling that and facilitating that. And like you said, Dr. Mahajan, we would definitely take on your thing of doing an innovation summit, and let's start planning that immediately and make it happen. Over to you, Amit.
No, thank you. And I can only say two things here. One is it's an incredibly proud moment for us. And there is no better institution than NatHealth for this partnership for two reasons. One is the quality of engagement of the leadership across the healthcare forum that I have seen at NatHealth, where this has been a big gap for the entrepreneurial ecosystem in healthcare to have not had. Just to give you some statistics, there are 7,800 odd healthcare startups in India, largely in the space of digital health. There is about $400 million that got invested in healthcare, digital health alone in the last 1 year. And which really means that this sector is at an inflection point. And one of the big things in healthcare has been that the value of death in startups is very high because many of the entrepreneurs who take the bold step of setting a healthcare venture may or may not have the experience in healthcare. And it is very important that they get the connect with the industry as well as have the access to the public health procurement system, which NatHealth has also established as a bridge that then enables them access to the market. So one is the funding. There is no shortage of funding in India. But I think what NatHealth will bring to these startups is market access. And I think this is why this partnership is so important. And Harsh, I completely agree with you. We should probably do an event and a connect where there is mutual learning and exchange between some of the startups and the industry leaders. And I think it will be incredibly enriching and mutually beneficial, where some of the ideas that have not seen light of day can move forward this sector. And one of the things that I think NatHealth also subscribes to, and what TiE wants to do, is create unicorns and healthcare startups for the global environment. Currently, if you see what has happened is there has been very few healthcare companies that have taken set stage in the global arena. And it's very, very important for this sector to develop that we create global companies from what is out here. And I think this is a step in that right direction. So thank you, Preetha. Thank you, Harsh. Thank you, Naveen. And looking forward to a great partnership. I'm, of course, the common link between NatHealth, where I've been part of it from day one, and of course, TiE. So looking forward.
Thank you, Amit.
Dr. Preetha Reddy, ma'am, any comments before we close?
No, I'm just looking forward to this tie-up. As I said, this is the future. While we will do our traditional ways of dealing with healthcare, it's the innovations, moving the point of care from, hospital, brick and mortar situations to literally to people's homes. So I think these will give us multiple answers. How do we use AI, ML to predict the disease or for correct and accurate diagnosis? All that will happen. So I'm really looking forward to, more than anything else, learning from the initiatives and the partnerships. So thank you, and I'm so excited that that's happening. So Amit and Mr. Raju, Dr. Mahajan, thank you for this.
Thank you so much.
Thank you.
Thank you.
Thank you very much to each one of you. A big round of applause on this partnership between NatHealth and TiE Mumbai. Thank you very much, esteemed dignitaries. And now, ladies and gentlemen, it is my privilege to briefly introduce the Secretary General of NatHealth, Mr. Siddhartha Bhattacharya, before he delivers the word of thanks, as also offer his concluding remarks for this 7th edition of the NatHealth Annual Summit. So let me just take a brief look at his profile and introduce him to all of you, ladies and gentlemen. All right, can we just have a look at his profile? Before that happens, because I think I should just quickly take the opportunity of thanking our partners and sponsors once again. Gold sponsors Apollo, Medtronic, Mahajan Imaging. Silver sponsors Fortis, Johnson & Johnson, Polymed, Siemens Healthineers. Bronze, Terumo, PD Hinduja Hospital. Our session sponsors Healthium, Century, Super Specialty Hospital, and Capsico. Once again, Kuhu, I would like to bring up the profile. so that I can introduce. Thank you so much. So the concluding remarks and the word of thanks, ladies and gentlemen, gives me a lot of honor and privilege to introduce Mr. Siddhartha Bhattacharya, the Secretary General of NATHEALTH. He comes armed with over 20 years of leadership experience in health, technology, and technology-enabled services sector across India and the US. He has demonstrated his leadership credentials in both public and private sectors in India, where he has been responsible for strategic advisory services, operational delivery, and technology leadership in the health sector. Mr. Bhattacharya leads the NatHealth Secretariat as the Secretary General, and NatHealth envisions itself as a competency center par excellence for public-private partnership, stringing the innovation network together with the healthcare realm and driving new programs to bring in government support and multi-sectoral partnerships. With that said, it is a privilege, sir, to hand the proceedings for the word of thanks to you, Mr. Siddhartha Bhattacharya.
Thank you, Aishwarya. As Secretary General NatHealth, it is a privilege for me to give the vote of thanks, the NatHealth 7th Annual Summit 2021. In the last few months, the entire NatHealth community has put in a lot of hard work to make the summit a success, and the last 2 days have been full of so many enriching discussions and perspectives. I will do my best to recognize some of those whose contributions have made this summit possible. I request forgiveness in advance in case I miss anyone out unintentionally. But everyone's contributions have made this summit possible, and all our thoughts and gratitude is with the entire NatHealth community. The most significant part of the last 2 days has been the fact that we have been able to focus on 5 very critical and most relevant themes of today to build a better healthcare system for India, made in India, for India. These themes are catalyzing the investment cycle in healthcare post-COVID-19, strategies for financing healthcare to accelerate the investment cycle and momentum for achieving universal health coverage, leveraging digital health, and better localization of medtech and integration to the global value chain for improving access and improving the quality of healthcare, reimagining health infrastructure development over the next 5 to 10 years horizon, and bridging the demand-supply gap in skilling. As a representative of the healthcare ecosystem for India, the NatHealth Summit sessions and partnerships have garnered a very clear roadmap of what we want to do over the next few years. We had a splendid line of speakers over 2 days. I would like to thank our honorable ministers and government leaders first, who supported us through their gracious presence. Our honorable Union Minister for Health, Science and Technology, Earth Sciences, and Chairman of the WHO Executive Board, Dr. Harshvardhan, for his inspiring message. Honorable Shri Anurag Thakur, Minister of State, Finance and Corporate Affairs, Government of India. Honorable MP, Mr. N.K. Singh, IS, Chairman, the Finance Commission of India, Government of India. Thanks a lot to each of you, sirs. I would like to extend my sincere gratitude to senior government representatives, Dr. R.S. Sharma, CEO, National Health Authority, Dr. Rajesh Bhushan, Secretary, Ministry of Health and Family Welfare, Mr. Pradipta Kumar Mohapatra, Additional Chief Secretary, Health, Government of Odisha, Professor Randeep Guleria, Director, AIMS, Mr. Alok Kumar, Principal Secretary, Medical Education Department, Government of Uttar Pradesh, Dr. Praveen Gedam, Additional CEO, NHA, Dr. S. Ishwara Reddy, Joint Drugs Controller India, Central Drug Standards Control Organization, Directorate General of Health Services, Mr. Ashish Jain, CEO, Health Sector Skill Council. Thanks a lot to each and every one of you, sir, for taking time out of your busy schedules and helping this summit and enriching this summit with your gracious presence. I would like to have a special word of thanks for our technical partners, IFC, starting with Ms. Rana Karache, IFC Regional Director, Asia Pacific, Manufacturing, Agriculture, Agribusiness and Services, Mr. Muazzam Mekan, Head PPP Advisory, South Asia. Mr. Alexandre Fernandez Oliveira, Chief Investment Officer, Health and Education, Asia Pacific IFC. Ms. Karin Bekongi, Global Social Infrastructure Lead. Mr. Amit Chandar, Senior Investment Officer. Dr. Pranav Mohan, Investment Officer and Health Specialist. Ms. Rupa Raman, Senior Investment Officer, IFC. I would like to thank our partners from multilateral agencies, academia, and other institutions. From USAID, Ms. Sangeeta Patel, Director Health Office, USAID Health Mission. Duke Global Health Innovation Center, Dr. Krishna Udaya Kumar. From Bill and Melinda Gates Foundation, Mr. Santosh Matthew, Country Lead Public Policy and Finance. World Bank, Mr. Owen K. Smith, Senior Economist. From FANA, Dr. H.M. Prasanna, President. From TiE, Mr. Naveen Raju, Executive Director, TiE Mumbai. From IP Global, Mr. Ashwajit Singh, Founder and MD. From Samrid Blended Finance Healthcare Facility, Mr. Ravichandra Natarajan, Project Head. From Senior Care Forum of NatHealth, Ms. Nanki Singh, GRSI, and Mr. Pavan Chaudhary, Vigan India and MTI. From IQVIA, Mr. Amit Mookim, MD. Some of the global speakers, industry leaders, and eminent external speakers, I would like to express my deep gratitude. Mr. Jack Langenbrunner, Senior Advisor and Health Financing Expert, Government of Indonesia. Mr. Herman Benema, MD Vectis from the Netherlands. Ms. Irina Vittel, Advisor, Business Building Expert, Indian Agriculture and Urban Change. Ms. Sunita Reddy, CEO, MD Apollo Hospitals. Our knowledge partners, Mr. Karan Singh, MD Bain and Company, Priyanka Agarwal, MD and partner BCG, Ms. Charu Sehg, Deloitte, Dr. Rana Mehta, partner leader healthcare, PwC, Kaustav Basu, Executive Director, Social Sector, PwC India, Mr. Ashish Rampuria, PwC, Dr. Vijay Raghavan, Director, Healthcare Management Consulting, and Ms. Tina, Ms. Radhika, and Ms. Swati, the team from IQVIA, who have really contributed to the patient confidence dipstick study. Thanks a lot to all of you from the bottom of our heart. I would like to thank the presidents of NatHealth for their guidance, their key insights, and the amount of work that they have put in terms of helping us shape the agenda for this event. It would have not been possible without their gracious guidance and leadership. Starting with Dr. Pratap C. Reddy, Mr. Sushobhan Dasgupta, Mr. Rahul Khosla, Dr. Arvind Lal, Mr. Daljit Singh, Dr. H. Sudarshan Ballal, and Ms. Preetha Reddy. I thank each one of you for your rich contributions and support. I would like to acknowledge and thank the leadership team of NatHealth, Ms. Preetha Reddy, Dr. Harsh Mahajan, Dr. Shravan Subramaniam, and Dr. Ashutosh Raghuvangshi for their daily guidance and insights in the way we have planned and curated the agenda for this event. I thank each one of you for your constant support and guidance in making all our initiatives a success. I would like to thank the Governing Council members of NatHealth and the entire general body of NatHealth, including our collaborators and partners. I would like to thank our sponsors, gold sponsors, Mahajan Imaging, Apollo Hospitals, Medtronic, silver sponsors, Johnson & Johnson, Siemens Healthineers, Fortis Healthcare, Polymed, and bronze sponsors, Terumo and Hinduja, session sponsors, Capsico Healthium, and Century Super Specialty Hospitals. We were able to do this event, organize this entire 2 days agenda, thanks to your generous support. Other partner agencies who have supported us in making this event a success: HealthBiz Insight, India Attitude, AVNWE, Impact PR, and NewsX. Thank you for taking the message of this summit to a much broader audience. I would like to thank the team from the President's Office, Mr. Raji, Shaileja, Mohandas, Mr. Mohandas, Ms. Deepa, Ms. Sylvia, Ms. Malati, Ms. Jayashri, Ms. Lata, Ms. Shilpi, all of you have worked tirelessly day and night to make this event successful. I would like to thank our financial support, our financial and accounting team led by Mr. Hitesh, Mr. Ashish, Mr. Vineet, and Ms. Mehak, who have really worked with all our vendors and pulled this summit and made sure that the financial part of the engine have been moving smoothly. I'd like to thank the entire team at JW Marriott. I'd like to thank the MC for this entire event who has done a wonderful job, Ms. Aishwarya Singh. And lastly, and most importantly, my dear Secretariat team, Ms. Anesha Pandey and Ms. Vrinda Chaturvedi for holding the Secretariat fort together, ensuring the entire summit agenda is threaded together and everything is in place. Thank you and have a wonderful evening ahead. Happy Holi to each of you. Jai Hind and Namaste. Thank you.
Thank you very much indeed, sir. Thank you for that wonderful closing and rendering the word of thanks. With that, ladies and gentlemen, I'd just like to say that NatHealth has lifted the mantle to make India self-reliant in providing best-in-class healthcare services to all citizens and putting the Honorable Prime Minister's vision of health for all into action with collaboration and integration, as NatHealth is a believer in the power of collective strength. And the challenges are mammoth, and our individual efforts may be a drop in the ocean, but coming together can turn the tide. In the great words of Mahatma Gandhi, drops make the ocean. The reason being that there is complete cohesion and cooperation amongst the drops. With that, please keep tweeting about the event. Still take insights from this event far and wide across all social media platforms with the hashtag NatHealth Annual Summit. Thank you very much. This is your MC, and now I'm signing off. Thank you.